After learning about sexual anatomy and the reproductive life cycles they facilitate, you may be wondering how to keep your body safe and protect yourself and your sexual health. Protecting yourself and your partners from contracting or transmitting sexually transmitted infections, or STIs for short, is a pillar of empowered sexual health. Because some STIs are becoming increasingly resistant to treatment, and if left untreated, can have significant and long-term impacts on health. Getting the facts about STIs is increasingly important for young people. In this unit, we will explore an overview of facts about STIs, talk about how to prevent them, give you information about where to get tested. Let's start at the beginning. Sexually transmitted infections, also known as STIs or STDs, are infections that are spread from one person to another, usually during vaginal, anal, or oral sex. Some of the most common STIs are chlamydia, genital or oral herpes, HPV, gonorrhea, hepatitis B, syphilis, trichomoniasis, and HIV and AIDS. STIs are really common and lots of people who have them don't have symptoms. All STIs fall into one of few categories: bacterial, viral, parasitic, or fungal. Bacterial STIs are caused by bacterial infections and include chlamydia, gonorrhea, and syphilis. Bacterial STIs can be treated and cured with antibiotics, but it's important to note that bacterial STIs are becoming progressively resistant to antibiotics, making them harder to cure. This means prevention of bacterial STIs is key for generations to come. Viral STIs are caused by viruses and include infections such as HPV, genital and oral herpes, hepatitis B and C, and HIV. Almost all viral STIs are incurable, with hepatitis C being an exception, but people positive for viral STIs can live healthy, normal lives with medication and medical treatment. Parasitic STIs are caused by parasites such as trichomoniasis, pubic lice, and scabies. And all parasitic STIs can be cured with oral or topical medication. Regardless of the type of STI you have, it's important to always seek treatment. While most STIs are easily treated and cured, if left untreated, all STIs can cause a variety of severe health concerns, including chronic pain, infertility, blindness, birth defects, heart disease, cancer, and even death. And the potential impact of untreated STIs is why regular STI tests for you and your partners are so important. You can have an STI and not know it. Many people never experience any symptoms but still have an STI. To avoid having an untreated STI, we suggest getting regularly tested regardless of symptoms. We'll talk more about frequency and how to get tested at Tulane later, but the good news is getting tested is no big deal, and most STIs are easy to treat. So now that we are more knowledgeable about STIs, you might be asking yourself, how does transmission exactly occur? As mentioned before, STIs are usually transmitted from one person to another during unprotected oral, anal, or vaginal sex. Some are carried in body fluids like semen, which is cum, vaginal fluids, and blood. Others can be passed from skin-to-skin contact or genital touching with an infected body area. Any sexual contact carries a risk of transmitting or contracting an STI, which is why prevention is key. Sex is more safer and more enjoyable when you and your partners are not worried about getting an STI. So, let's talk about some important STI prevention techniques. If you are having sex, use condoms, internal and external, every time. Condoms are effective at preventing most STIs, including chlamydia, gonorrhea, syphilis, and HIV. Condoms can prevent STIs during vaginal, anal, or oral sex, and are free and readily available on Tulane campus. We're going to talk a lot more about condoms and other barrier methods of protection in the Safer Sex Methods unit. Consider PrEP, pre-exposure prophylaxis, to reduce your risk of getting HIV. For people at higher risk for exposure to HIV and AIDS, PrEP is a pill they can take daily to greatly decrease the risk of HIV infection. We will go into more detail about PrEP and talk about PEP, which is post-exposure prophylaxis, in the next unit, Safer Sex Methods. Get vaccinated. Some STIs can be prevented through immunization, including HPV, hepatitis A, and hepatitis B. If you would like to talk to a medical provider about accessing STI prevention vaccinations, you can make an appointment with the Student Health Center. Get tested regularly. Remember, you can't always tell if you have an STI, and the best way to know for sure is to get tested, so let's talk more about that.